So balance. The cervical spine, we have a very high range of motion. And historically, when we've kind of compared range of motion to stability, we've compared the glenohumeral joint at the shoulder to the hip, right? So our glenohumeral joint, we have a huge amount of range of motion, but we have quite a bit of decrease in stability because to allow for that range of motion, we don't want such a strong bony block preventing it from being able to move. So, and then the hip, we want to have a lot of stability, but we don't need quite that range of motion, so we actually have the head of the femur almost halfway encapsulated by the acetabulum, held in place. So within the spine, we've got the cervical region, which has a high range of motion, but a fairly low level of protection. It's not too terribly difficult to injure your cervical spine. Whiplash is a good way. Stress just seems to drive everybody's upper traps nuts. Now the thoracic has a high degree of protection with a very low degree of range of motion. It doesn't move much, it doesn't want to, it doesn't need to. Then the lumbar region has a fairly high level of range of motion. It needs to have a high level of protection, but it kind of has a weak stability by muscle. So lumbar region is where we start seeing a lot of chinks in the armor in terms of how we address and how we deal with these problems with long-term pain. Because understanding all the dynamics of the muscles that stabilize the lumbar region through core stability, through activation, through teaching people how to be people, we end up with problems with the lumbar spine. Because we need it to give us a high degree of motion, but we also need it to protect everything that's coming out and through it. So every bit of that we've talked about except for, we'll get there. So transverse process, point of attachment for intrinsic muscles. So you're going to have some muscles that go from one spinous process, one transverse process to the one above or immediately below it. You're going to have one that jump 2 gaps. The rotatories are in there, multifidi are in there. There's small muscles that kind of go 1 or 2 gaps between spinous processes to move them individually. And those transverse processes are there to kind of create those anchor points. The spinous processes are largely, there's ligamentous support that kind of bands all of them together. And then the angulation, it helps limit the motion you can get. It always blows my mind to see when we had that, was that yesterday? Oh, you watch like gymnasts, you can do like those back bends that they can almost like put the contortionists put their head through their heel. I mean, just the crazy bending. I never quite understand what's going on with their spine. I'd love to see like functional MRIs as they're moving through that. Just because I'm not quite sure how they exist. So, facet joints. These are synovial joints, which means what? What does it mean for them to be a synovial joint? What's that? Move freely, but what are anatomical components are they going to have?
Nervous system.
It's going to have a joint capsule that goes around it. There's going to be a cartilage in between the 2 articular surfaces. There's going to be a synovial fluid inside. So they're pull-on joints. They are freely moving, movable joints. So like anything else, we can injure or damage those joints. Medial portion of the superior facet articulates with lateral portion of inferior facet. Unloads compression force from the vertebral bodies by 20%. So they take a lot of the load. Pedicles and lamina create the rest of that arch as we move around the vertebral arch. What goes through the hole? Spinal cord. Excellent. Pars interarticularis. So this is kind of a difficult. So we look at, we've got 2 vertebrae stacked on top of each other. Superior articular facet, inferior articular facet. So there is that articular surface, that pars articular surface there. We can get an injury in this pars interarticularis. So interarticular means it's in between the articulation. So in between the pars articulation, and this is your pars right up in here. So this is a solid chunk of bone. Now this synovial joint is strong enough that what we'll see on occasion is a fracture in through here. We're going to see it more often in the L4, L5 region of the spine, and I'll explain more of that in ortho. But you'll hear terms spondylolisthesis, spondylolysis, which is either a fracture or a dislocation where this is broken, and so the joints have held and done their job, but the bone has given way. And again, seeing as how these unload about 20% of the weight of the mass of the vertebral bodies, to have this fracture end up here is going to create some significant instability within the spine. We see these injuries in people who actively arch low back, increase lumbar lordosis. Take a 100-pound gymnast who does a double flip, dismount, whatever Mendoudad, and then lands it and lands like this to where there's a lot of low back arch. You're going to end up having a lot of stress that can create fracture sites here. So again, we'll talk about that. It's a common site for stress fractures. All right, so how are we different? C-spine. Atlas C1. This is a ring. This cradles the base of the skull. It's not palpable. It's too deep. There's too many muscles in the way. It sits way up underneath the base of the skull. It kind of sits underneath that foramen magnum, that hole at the bottom of the skull. It has a unique little articular point here, which actually holds on to is the articulation point for the dens. So C1 sits on C2, and the primary function is rotation of the head. That's the motion in through here. C1 as it sits on C2. So C1, the superior articular facets form the atlanto-occipital joint. So the occiput is the base of the skull, so this is the anchor point of C1 onto the base of the skull. Has long transverse processes, but functionally no spinous process. Now, something else you'll find in the cervical spine is that the spinous processes, as they're there, as you get further down, you end up what they call a bifid. So you can see how it kind of forks out here. So that's another unique characteristic that you'll see with the C-spine. And again, that's to help increase the ligamentous anchor points, the support that's there. So the axis. Who was Atlas in mythology? He held up the world, which is why C1 is named the Atlas, because it's holding up the skull. This is the axis, and that's because it rotates. It's got the point of rotation for the head. So the dens forms the atlanto-axial joint, primarily responsible for head rotation. And as you might imagine, something little like that, we'll talk about in ortho, but there's plenty of ways we can crack that little guy off. Thoracic spine minus the typos up there. Thinking for articulations with the ribs, T1 and then T10 through 12, the superior costal facet on vertebral body. So there's an articulation component. T2 through T9, there's a superior and an inferior costal facet. So the T through to T9 articulate both of the rib above and below. Now those articulations are not synovial joints. You can actually dislocate those fairly easily. You can move them around. It causes some pain. And if it's not managed right when it first happens, then you can have a recurrence to where it kind of comes in and out. Sacral, the anchor of the spine and lower extremities. So every bit of your upper body mass goes to your sacrum, and then your sacrum goes through the SI joint, sacroiliac joint, into the pelvis. So we've talked about it from the pelvis before, but this is looking at it from the point of the sacrum. Now, typically, this is S1 through S5, which is effectively the 6th lumbar vertebra is actually your S1, and it fuses on down. It is possible, like in the picture here, where L5 fuses in with S1, so you have 6 stacked high for your sacrum. And it's also possible to go the other way to where you have a free-floating S1. And those are all just going to be congenital components, nothing that you're going to identify that needs to be done with it. But that can impact some of the articulations we have in the stability of the SI joint. So articulations, two primary types. We have the intervertebral joints. In between the vertebrae, there's a cartilaginous disc in between the vertebral bodies. And the zygapophyseal joints, which are those pars. The discs themselves are made up of different kinds of stuff. We have the annulus fibrosus, annulus meaning ring, so it's ringed fibers that go around the outside. And then we have the nucleus pulposus, which is the inside squishy stuff.